Randomized trial of hyperglycemic control in pediatric intensive care. Definition: hyperglycemia is a common complication, is critical illness, and is associated with adverse outcomes when five single symptoms. Randomized trials have shown the reduction of blood glucose to normal levels with the use of insulin, reducing morbidity and mortality among adults in surgical intensive care units (ECUs), with similar effect on morbidity but not on mortality.
Researchers at Joslin Diabetes Center have found a new use for an old medication, the treatment of type 2 diabetes.
We have found that a medication that has been used for many years to treat arthritis is actually beneficial to improve blood sugars in patients with diabetes.
Doctors Allison Goldfein and Stephen Scholson conducted a clinical trial of the drug salsalate, a cousin of the common drug aspirin.
It is a derivative of salicylate. Salicylate is one of the oldest drugs known to man. It's been apparently in clinical practice at least since the time of the Egyptians. We found evidence of its use.
So in this specific trial, we identified patients who had type 2 diabetes that was inadequately controlled on their current medications. And they were randomized to take either salicylate or placebo and be followed for a period of a year.
They saw the people taking salsalate had lower blood glucose numbers than those taking the placebo. Salsalate as a diabetes medication works by reducing inflammation associated with being overweight.
So we would envision that this would be one of the cheaper drugs that could be brought to market because it already is generic and quite inexpensive.
Though salsalate has been used for medical purposes for years, it has never undergone a clinical trial.
When salicylate was first developed as a drug for the treatment of arthritis, the same type of clinical trials that we conducted were not necessary in order to have drugs approved for marketing. So it's really the first formal testing of a very old medication.
Along with reduction in blood sugar, they found beneficial effects on levels of triglycerides and uric acid.
So it's all new findings for maybe the world's oldest drug or one of the world's oldest drugs.
Next, they plan to learn more. They are currently conducting a trial on the effects of salsalate on heart health.
Treatment: the randomization of patients to conventional glycemic control or triglycemic control was performed by means of a central computerized system with the use of a minimization algorithm. In the conventional glycemic control group, insulin was infused intravenously when blood glucose levels exceed consecutive blood samples obtained at least 30 minutes apart and was discontinued with blood glucose levels fell below .
Type 2 diabetes is changing. Once known as an adult onset disease, type 2 diabetes in children is on the increase. in children are the same as in adults. Increased thirst and urination, weight loss despite increased hunger, fatigue, blurred vision, darkened skin, wounds that are slow to heal. These young lives are cut short. They are left to deal with problems that are usually experienced by older people. As a parent, it is difficult to see your child suffer, and even more difficult to help them come to terms with an older person's illness. You can change their lives with just a few simple yet disciplined steps. These steps are all found here. www.cureyourtype2diabetes.com/type2diabetes.html. It's your starting point and a step-by-step program that gives you the help and support to make lifestyle changes for your child so that the necessary changes become the norm as opposed to the exception. Visit www.cureyourtype2diabetes.com/type2diabetes.html right now and sign up for more information about this exclusive and affordable program. Your child
Statistical analysis. A difference of 2 days in the number of these free-flow mechanical ventilation at 30 days was considered to be clinical importance on the basis of data from the UQ Pediatric Intense Care Audit. We calculate that we a sample size of 1,000. The study will have 80 power for an interaction test to detect a 2 days difference in the effect on intervention because the cardiac is so low.
So I'm originally from Toronto, Canada, and I did spend some time on the East Coast here in the US in Philadelphia. I started here as a travel nurse, and I came here and I fell in love, and it's 5 years later and I'm still here. He was born with pulmonary and aortic stenosis and an atrial septal defect. He had a surgery 12 days ago, so overnight we'll be working on getting his lungs optimal in the hopes to extubate him tomorrow. I recently transferred to critical care from the emergency department, and it's a completely different environment. The skill set is different, the patient population is different, my day-to-day activities are different, and I've been on orientation for 4 months now. Is that good? Okay. Oh, I see what you mean then. They give you a lot of education. There's a lot of opportunities to grow within the department, within the organization. He's at 3.9 cc's per kilo per hour for his 24 hours. This hospital really supports its staff and its nurses to make the best decisions for the patient. And his maps they've wanted to keep it above 45. On the epi he was above 50, and so we've titrated it down, and now it's off, and his maps have been low 40s to high 40s. We do have, as nurses, a lot of autonomy, and we use a lot of our critical thinking skills to kind of help guide what we're doing. A little after 8 o'clock, because it was right after shift change that he started getting really hypotensive. There are parameters that are set for us and orders that the physicians put in, but then within that we have flexibility so that we are using our own judgment, our own clinical skills to determine what to do for the patient. You're awake. What time is it? You should be sleeping. This is an awesome place to work. We have a brand new facility, top of the line technology. We perform groundbreaking surgeries here. We do a lot of research here, so we're always trying to advance what we do in terms of the techniques that we have. Like some of the surgeries that we perform here in the cardiac ICU are not done in many other places in the world, in the country. So you don't feel like you're just kind of coming to work, coming to a job. This is more like a career. This is a place that you can flourish. You can stay here a long time and grow within the organization and have lots of opportunities to, advance. All right, let me just pull up this chart. It feels good to come to work in a place that, you're supported and you're making a difference.
Discussion. In this multi-center randomized trial involving critical ill children in pediatric issues, the glycemic control did not increase of the number of days that children were alive and free from mechanical ventilation and 30 days. However, the secondary outcomes reveal a complex relationship of potential benefits and harms. Although the glycemic control was associated with a smaller proportion of patients receiving renal replacement therapy that was conventional glycemic control, it resulted in more episodes of hypoglycemia.
This is Sherry Boschert reporting for Global Medical News Network. There's new consensus emerging in the world of diabetes about easing up a little bit on the glycemic levels of hospitalized patients. Dr. Mary Korakowski discussed this at the annual postgraduate course of the American Diabetes Association in San Francisco.
It was a consensus statement between the American Diabetes Association and the American Association of Clinical Endocrinologists to try to prevent a return to uncontrolled glucose levels in the hospital, which we know are associated with adverse outcomes such as infections, mortality, higher length of stay, cardiac arrhythmias, and to at least come up with a guideline for physicians who work in the hospital to use in caring for these patients. There's been a lot of variability in what's been published in the past several years. The study that brought this whole issue to attention recently was actually promoted a glycemic target of 80 to 110, which is lower than even what we try to aim for in our outpatient populations in many situations. Several subsequent studies since that original study showed that there is a hypoglycemia associated with aiming too low for those glycemic targets. And we don't really have the tools that help us safely get to such a low target in the hospital. Patients are ill, often they're anemic, often particularly patients in critical care units may have a low blood pressure or be on medications to maintain pressure. And all these things can affect the accuracy of what a blood glucose reading is when it's done with a bedside glucose meter. So we're probably not ready for those targets. The guidelines have been revised to try to aim more for a glucose of 140 to 180, which has been what's achieved in many of the conventionally treated groups in the studies that have been published. And at least there we know we are achieving a reasonable level of glycemic control where the risk for adverse effects associated with high blood glucose are minimized, but also the risk for a low blood sugar reaction is also minimized with a higher target range.
Reporting for the Global Medical News Network, I'm Sherry Boschert.
Methods we randomly assigned children 16 years of age who were admitted to the pediatric intensive care and ICU and were expected to require mechanical ventilation and exhaustive drugs for at least 12 hours to exert glycemic control with a target blood glucose rate 62 to The primary outcome was the number of days alive and free from mechanical ventilation after 3 days after randomization.
Where to find the best sites. Types of diabetes. Hello. The best internet resources about. What is hyperglycemia? These are the best resources we could find on the web. The most helpful site to learn about what is hyperglycemia is en.wikipedia.org. See the page titled Hyperglycemia, Wikipedia, the free encyclopedia. This is the link.